Hi, this is Dr. Farley. Today I'm going to be going over with you the devastating effects of dementia and Alzheimer's. I've had personal people in my own family that have gone through this. I wish that early on we would have known some of this information to make changes and would not have seen the total mind erasure of family members. And there's definitely steps of action that you can take to get a real plan of action. And a real plan of action is not taking the drug for the dementia and Alzheimer's. That's not a plan of action. That's possibly maybe a smidge of improvement. I've had people come in here that they've been on the drug for 2 years, 5 years, 10 years. It's not helping whatsoever. So if it makes a difference in your symptoms, okay, but you need a deeper, more thorough plan specific to you. Just some numbers on this massive problem, dementia and Alzheimer's and cognitive decline. In the United States alone, total costs are over $214 billion. In worldwide, this is a $604 billion a year problem, and that's from 2012. So there's going to be $36 billion in out-of-pocket spending, and an average patient with dementia and Alzheimer's will spend $56,290 out of pocket between direct and indirect costs. What you want to understand is you're going to have to spend some money to figure out what's going on with you, or you're going to spend the money down the road as you get worse and worse and worse, and your mind becomes erased. You must do what you can. You must take action right now. You cannot sit around and let this get worse and worse and worse. The drugs do not address the underlying root functional causes. They do not address the mechanisms, and you need a deeper, better plan than that. What you also want to know too is there's causal factors, and what I've found is there's usually going to be many to each individual patient. So one person may have had numerous head traumas. Someone else may have been an alcoholic. Someone else may have been around a lot of pesticides and herbicides. Someone else may have eaten wrong their entire life. Someone else is a diabetic. Someone else is having a thyroid issue. Someone else is having poor methylation, lack of nutrients. Someone else is having sustained inflammatory responses. Someone else is having ear, nose, and throat chronic infections. Again, numerous things are creating this dementia and Alzheimer's major issue. So we have to identify those causative factors specific to you. If you have not gotten a good assessment, you need a good assessment. The idea to go in and say, hey doc, I think my memory's no good, and then all you're really going to get is the pill, the magic bullet. You're left with no chance, period. It's just not going to happen. The drugs, if they help, it's minimal. And again, I've seen thousands of patients over my last 25, 27 years. And many, many, many of them have come in with, hey, my memory is no good, my cognitive decline is down, I'm having brain fog, other signs that my brain is breaking down. There's usually a therapeutic window from when the causative factors start to create the breakdown, and then you may have about a 20 to 40 year preclinical disease stage time. That means if someone did an analysis on you and was to start to measure and find some of these things, you could actually get a real plan to stabilize the brain, reverse some of the issues that are going on by raising function, and also go in to address what are the root functional causes. I mean, if you have these chronic issues and you don't address them, there's no doubt in my mind that you're circling the drain, and over time going to go down the drain, and your memory and your brain will follow. The conventional diagnosis usually gets you when there's about 85 to 90% damage. And then gradually, again, we give you the drug. We do nothing to address the causal factors, the root functional causes. And then gradually, over a time frame, the person just gets rapidly declines more and more and more. Their brain gets erased more and more and more. Their ability to speak goes down. Their balance and their walking gets less. They, over time, can look very frail. They start to have trouble putting together sentences. They don't remember who they're talking with. They're making a lot of mistakes. They really don't even understand the context of what's going on, and it's a sad state. So the three approaches that people can take with this problem is the typical allopathic drug model. Okay, and we just explained that you have to have 85% damage and then you come in. And then they give you the drug, whatever the drug is, the magic drug of choice by that doctor, and you take it. And it really, for many patients, it doesn't seem to work. And there's even research that sometimes these drugs are actually progressing the disease. What you also want to know is that when you go to the typical allopathic drug model, that you're usually told that there's a genetic component to this. Well, the research on this is about 1% of dementia and Alzheimer's is actually genetic. 1%. So if you're a family member, a child, and your mother or your father has this, it doesn't mean that you're doomed at all. It means that you also should look into this now. Identify what are the root functional causes specific for your parent or your husband or your wife, and also an assessment should be done on the children so that we are identifying and not walking around in fear. 1% of this is genetic. 99% is epigenetic, which means we can identify what those things are. I am an epigenetic specialist. That is what I'm good at. What is not functioning well? What are we doing wrong? And what could we do differently to change this around? The second model is the alternative integrative model. And the problem I have with that is there's usually minimal difference in the approach. The thought is exactly the same. You have Alzheimer's, dementia, it's likely genetic. And by the way, how do they confirm genetics? Any family history? Anybody? Your uncle's cousin's brother? If you have any of that, they tell you it's genetic. And it's really totally not scientific whatsoever. 1% has been shown to be genetic. We have to stop asking those questions. Now, if there's a family history of it, a grandfather, a father, and a son, it doesn't mean we should throw that information out the window. But it absolutely does not mean it's genetic. It could mean that we have the same epigenetic problems in 3 generations of family members showing up as dementia and Alzheimer's. We still can address this from finding the actual root functional causes. So the alternative integrative model, some of the practitioners there may be alternative doctors, integrative doctors, complementary doctors, chiropractors, homeopaths, functional medicine, naturopaths, acupuncturists. They're still treating dementia and Alzheimer's. They're not treating you. Okay? It's not specific. If it's not specific, it will not work. We cannot do cheap protocol care. Cheap protocol care is, okay, dementia and Alzheimer's, here's your pill. Cheap protocol care is, you have hypertension, here's your pill. It's the least thoughtful and the worst way to approach a health problem, because we cannot put people in boxes with a diagnosis and think that we're going to give everybody this drug and somehow we're going to have good outcomes. This is the reason why our healthcare system is in total chaos. Total chaos. So the alternative integrative model, again, let's try this herb for your memory. Let's try this vitamin for your memory. It's got to be much deeper than that. Again, it's got to be specific. So our neurobiomedicine model, we have an unbelievable assessment, number one. From there, we would determine whether the case qualifies or not. If the case does qualify, we will lay out for you specifically what blood work do you need, what specialty blood work do you need, any other testing that would be required. And then from there, we set up an exact plan to knock off what we found specifically wrong that's interfering with your function. And then, the power that made the brain and the body can heal the brain and body. On my website, you see it says God does the healing. My objective and my role, as far as healthcare is concerned, is to just remove interference and let the brain and the body work to the highest optimal level that it can. And I can tell you that when I do that, just like when I drop this pen, it's going down. When you correct the root functional causes inside of the person's brain and body, many times there's rapid, dramatic changes that can happen. So what's the goal with a dementia Alzheimer's patient? Well, first of all, we'd like to see how much better we can improve the person, and we'd have to know what the basic starting measurements are. That's why you have to do good testing. Then from there, we would like to see if we can stabilize the brain and the body so that we don't continue to see a rapid decline. And then lastly, if the person is going to get worse over time. We keep it at the slowest rate possible, okay? And again, if you do not address the underlying root functional causes specific to you and your dementia and Alzheimer's symptoms or diagnosis, there is no opportunity to get better because we're not addressing the mechanisms and the causes. So I hope you found this interesting. If you would like to have a conversation, please, there's information below here on how to get in touch with us. We would set up a time to do the consultation, look at the entire case, and then make a decision whether you would qualify to move on to the full assessment or not, and then ultimately after that make a determination whether you would qualify to become a patient and be involved in a full program or not. So thank you. If you have any questions, please let us know, and God bless you and your family. Thank you.